Welcome to today's Lunch and Learn series by Kaplan. My name is Meredith Ashley, and I am a nurse education consultant with Kaplan. Today before we begin the Zoom, before we get started, I want to point out a few features in the Zoom room. Feel free to post any comments, thoughts, ideas, or questions you have in the chat area for all attendees to see. We'll make every effort that we can to get them answered before the end of our time today. We'll also have a Q&A time at the end of the presentation. I did post in the chat already. If you'll go ahead and include your name and institution and state that you're joining us from today, that just kind of helps us see who all's here today. We will be posting a link at the end of today's session for an evaluation survey. That way you'll get your certificate of attendance at the end if you complete that survey. And I'll post that toward the end of our time today. We hope that you'll take a few minutes just to complete that evaluation on today's session, as we value your feedback. It's very important to us. This session is going to be recorded, and the slides from today's presentation will be made available once the recording has been posted. You will have access to the slides and the recording at the registration page. Usually it takes around 48 hours after the live presentation for that to get posted. Our topic today for today's webinar is test a next generation scoring model with our Novice Nurse Educator series. And we have Karen Hadaminas here with us today to present to you all. She's fantastic, and I know you will all learn a lot from her. Karen has been an educator for over 40 years and has been in neonatal and mother-child, as well as the emergency room, and both for adult and pediatrics. She's fantastic and has been a nurse consultant here at Kaplan for over 14 years. So we're excited to have her today. In 2007, she made the transition to academia, focusing on curriculum and new program development. Karen's held many roles with her faculty positions, including clinical educator, faculty, and dean. Karen joined the nurse consultant team at Kaplan in 2012. She currently serves in the Northeast Territory and enjoys assisting faculty members with the utilization of Kaplan's resources into their individual curriculum. She also serves as a Kaplan ambassador to new employees mentoring program and a member of the K4K social events team. Karen, we are so excited to have you today and learn from you, and I'll go ahead and turn it over to you now.
Okay, thank you, Meredith. Thank you everyone for joining. This is a novice nurse educator, but I think we're all novice as we're talking about these new scoring models. So I hope that I don't have your head spinning at the end of this, but it is a little bit confusing as we're all learning the new methods. So I'll start with, let me just click on that slide here. Here we go. Today, these are my objectives: to identify the 3 rules that National Council utilizes to score the Next Generation NCLEX exam. We're also going to discuss why we needed to make the change to polytomous scoring to accommodate these new questions. And we're going to look at the item response theory and how that plays a role in Next Generation NCLEX. National Council State Board of Nursing is the gatekeeper of the new scoring model for the Next Generation NCLEX exam. These new rules were put in place when the exam went live in April of 2023. I can't believe it's already been 2 years now. We just seem like we were forever working up to this, and we're now here, and we have more than a year worth of data and almost 2 years worth now of how students have done on the new NCLEX exam. So there's a great deal of information, videos, all kinds of material on MCSBN's website explaining the rationale for these changes. So basically, the board looked at it and said, are we really testing what we say we're testing? And they were very open and honest, and they said no, they didn't feel they were. So this changed the focus completely, and the focus moved from measuring nursing knowledge to measuring clinical judgment. The clinical judgment measurement model was then created as a tool to measure clinical judgment. With the measurement of the clinical judgment model, we also had to develop some new style of questions. And the new item types needed new measurement methodologies. And that's where polytomous scoring was implemented. In the past, the NCLEX exam would award credit only if the student answered 100% of the question right. Polynomous scoring now gives partial credit for partially correct answers, and it helps improve reliability and validity of our test results, which we all want. Here you can see the definition that says it is a simple method of assigning scores to data that has more than two possible answers. Sounds easy so far, but you may be familiar with the classical test theory that's used on evaluating tests, known as CTT, but the classical test theory calculates reliability of the exam. But even better, IRT will analyze each individual question on the test. So today, major exams such as SATs, GREs, and even the NCLEX exam use the techniques of IRT. This is because IRT increases the reliability of the test over the classic theory. IRT also allows for computer adaptive testing. You should all know what that is now because our NCLEX exam is computer adaptive. Okay. We need to look at where the next question will come from. So with computer adaptive, the next question presented to that test taker is tailored to the estimated ability of their level, so resulting in shorter tests and more accurate results. And we know students love when their test turns off at 85 questions. And as a faculty member, I panic when it shuts off at 85 because they either passed or failed. At least if they get more questions, they're continuing on and the computer hasn't determined whether they have passed or failed yet. But among other things, the purpose of IRT is to provide a new framework for evaluating how assessments work and how well individual items on the assessments work. The most common application of IRT is in education, where psychometricians use it to develop and design exams. They use it to maintain Q banks or question banks of items, and they use it for equating the difficulty levels in excessive versions of an exam. For example, they'll compare a test results from last time over time to new ones. So that really helps us improve how we're writing. The NCLEX exam has 3 scoring rules. The 0-1 scoring, better known as dichotomous scoring, only awards 1 point for if an item is answered correctly. Students do not earn points if any part of the answer is incorrect. So basically, it's either right or wrong. The next 2 methods for scoring are new to the NCLEX exam. The first one is the plus-minus scoring, which allows students to receive points even if they don't get 100% of the question correct. Students will receive a point if they answer correct, but they'll also lose a point if they answer incorrect. Students will never receive a negative score on any test question. The rationale scoring, I think, is the hardest to understand of all of them. The rationale scoring method is also new to the NCLEX exam. Remember that NCSBN is actually trying to measure the student's ability to identify cause and effect, which relates back to the clinical judgment measurement model. I like to say, if this, then that. So the difference with the scoring is that the students now must peer together. And I did underline that there because that's the most important part of the rationale scoring. So they have to pair options together to receive a point. If a student selects a correct medication or treatment, but they can't identify the diagnosis maybe, then it will be marked incorrect. We're going to look at each of these as we move through the presentation. So this grid here, Kaplan had developed just as a quick reference for faculty, and I think it's extremely helpful, especially as you're beginning to write some of these new style NGN questions. You know, if you're writing a select all that apply, what type of scoring method should you use with it? I think this helps a lot. With this grid, it's showing plus or minus. So we're all familiar most with the select all that apply, and there are different methods even for that. The new NGN question can actually have, or select all that apply question, can have up to 9 possible points, okay? In the past, they used to see maybe 5, sometimes 6, and the students still thought that was a lot. But by the number of correct answers, it's not the same as the correct selections. So in the past, if a student selected 100% of correct answers, if they didn't select 100% of the correct answers, it was marked incorrect. There was no partial scoring. This is no longer the case with polynomous scoring. So I know this looks a little bit busy here. This is an example of a case study question from Kaplan. So the case study questions will always have the case study on the left-hand side of the page, and on the right-hand side of the page will actually be the question. So let's look at an example of a 0-1 scoring. This is a drop-down closed question here, which I've identified at the top. But before we go into that, let's take a quick minute to talk about case studies. They are also new to the NCLEX exam, but they're scored the same as traditional questions. All case study or sets will have 6 questions within them. The first question of a set will always be to recognize cues, and that will be followed by analyze, prioritize, generate solutions, take action, and evaluate. I was losing track there. We should know those by heart. That should just flow off your tongue. I do say I'm usually pretty quick, but I don't include recognize cues. I don't finish the whole thing, but something you should be very familiar with. So I hope that these sound familiar to you. This question is identified on the left-hand side of the page here as being step 4, or question 4 of 6 questions. So using that clinical judgment measurement model, if it is the 4th question in there, the student's going to be asked to generate a solution. If you look at the question here, the question's asking the student to generate a solution to help the client maintain their blood pressure and weight loss goals. Okay. Built into the remediation of this test question is the NCSBN scoring guidelines that you see with the yellow arrow here. The student can click on these scoring guidelines to better understand how the question was graded. This is extremely helpful to the students, but I think even more to faculty. As we're all learning the new scoring rules, it just helps support that we've selected the right, or we've used the right scoring method with our questions. We're all learning these changes together, so we have to be patient with each other. I could not skip over the clinical judgment measurement model without at least putting a diagram up here. It's just like the students. When you ask them if they know how to move a decimal point, everyone's afraid to say, they don't know how to do it. So same thing with clinical judgment measurement model. There's a lot of these graphs out there. You can Google it. You can go to NCSBN's website to find this. If you can believe it, it took 10 years for National Council to create this. They actually presented this model, which was just the clinical judgment model, back on October 11th of 2019. So it's been that long in development. And when they released it to us, that it would be the measurement model that everyone would be using. It does not replace the nursing process, just so you know. If you look, I did mention recognize cues, analyze cues, prioritize the hypotheses, generate solutions, take action, and evaluate the outcomes. Those are the 6 steps of the clinical judgment model. But if they match up perfectly at the bottom of the page with what we know as the good old nursing process. So we always tell students, assess first. Well, that's the same thing. They're going to look at the case study and see if they can recognize any clues there. Analyze matches perfectly. We ask them to plan their treatment. That's the same as generate solutions. I say just a little change of the words. Then they need to implement their actions, which is now take actions. And finally, at the end, did what they did, was it successful or was it not? Did it help the patient or did it not? So this is just a very quick overview of the clinical judgment measurement model. So going back to that question that we looked at with the client who needed to generate, the student who needed to generate a solution for the client. This question that we looked at, when we click on that scoring guidelines, it will bring us directly here into that NCSBN document on scoring, and it will bring us directly to the explanation of the drop-down closed question. And it's going to explain here why this student is going to be awarded a point, okay? Or why they're going to lose point. So we're going to look at the question just a little bit deeper. So in the same question here, there are 5 sentences that needed to be completed in this question. This means that the question is worth 5 points, okay? The student will select from the drop-down in each of the sentences. The last sentence down here, you can see I did open this one up. I didn't want to hide too much on the question, but you can see what options were available to the student. They had to pick from obtain daily weights, obtain hourly blood pressure while awake, it's a lot of work, or to actually obtain a case of frozen meals for the patient to select every day. Those were the options. Kaplan also provides the correct answers if the student answered it incorrect. We want to make sure that they're learning from this experiment, from this example here. The student selected the 3 correct answers and 2 incorrect that you can see from the arrow here. In the past, this question would be marked incorrect automatically because they made 1 incorrect selection. Okay, now they actually get points for it. So no points are deducted using the 0-1 scoring. So if we look at the breakdown, and I did put it on the right-hand side here in bright yellow for you. The first question was answered correct, they get a point. The second, they receive a point. That's now 2. The next 2 options, they got incorrect. And then the last one, which question 5, they answered correct for a total of 3 points. The student can see at the top here that this question was worth 5 points. They answered 3 correct. They did answer 2, but we don't deduct that when we're using the 0-1 scoring. Another example of a 0-1 scoring rule is multiple choice. This is the second example of using it. This will also be used following the same point only if you get it right, no points if you get it incorrect. I selected this question actually, to highlight the importance of reading an entire question. Okay. So it says to fill in the blank. There's also directions at the bottom here that will tell them each choice can only be used once. They need to make sure they read, okay? Each blank must be completed with a response. It says dragged into the answer well. And what you do see here is they did select 3 options and there's 3 more here. So within this well, or within these options here that they had 6 to pick from, and they had to select the correct 3 and pull those up. So you can see here, this student selected correctly, all 3 of them, and they did not get any incorrect. That's a simple multiple choice question, one that I say we're all familiar with. Writing the test question is a little bit different. This one is another example of the 0-1 scoring. This is a matrix multiple choice question. For this item, each row is scored independently with a 0 or a 1. The maximum score is the total number of rows provided. So if you look here and count these up, there are actually 7. So this question has 7 rows, which means it's worth 7 points that we see at the top here. When you look at it quickly, you may be confused and think it's similar to the plus minus scoring, because at first glance, it looks like the student lost 2 points for 2 incorrect answers. But in fact, the student only answered 5 correct questions, so they earned those 5 points. The student did not have anything deducted, so they did not lose for the 2 incorrect answers that they have here. Other questions that use the 0-1 scoring, and I did not put an example of all of them here, would be a multiple response or an end question where they're told to maybe select 4 possible answers, and a drop-down table where they'll have more information in a table format. Okay, and the most, I would say, popular one is the bow tie question. So the bow tie question looks just like that. It is a bow tie. It will always be worth 5 points. They will get they'll get 2 boxes to put in their take action. There will be 2 boxes on the right side of the bow tie, which are the parameters. And then in that center of it, they will pick the condition. Okay. With that one, they can get 1 point, or they could get all 5 points with the bow tie. So we're going to switch now to the plus minus scoring. So this plus minus scoring, we're going to talk about select all that apply questions. And this one that we have here is actually within a set or a case study. This question has 9 possible options, which are easily identified here. Okay, that will be the maximum number of options that they'll have on the NCLEX exam. The author of this question determined that there would be 7 correct options, not 9. So this is often a common misconception where faculty will say, this question was worth 9 points. There's an error here because you said it's only worth 7. Well, with this, there are only 7 correct answers. So that's the maximum that the student can get. Okay. So the rule with the select all that apply can be, there can be 1 correct answer, or all of the answers now can be selected as possible options or as correct. In this one, the student answered 7 correct and received 7 points. But they also answered 2 incorrect. Okay. So with the plus minus scoring rule, they'll lose the 2 points and they'll get a total of 5 points on this. The importance of a select all that apply rule is to teach students to only select the options they're absolutely sure of. Okay. So what we found many students were doing is they were selecting every single one. Okay. If they selected them all, then obviously they're going to get all 7 points. What they didn't realize is maybe that question is worth 3 points and they selected all 7. They're going to lose 4 points and it's going to be worse off. Okay. So what can you do as faculty? You need to teach your students that the new rule for select all that apply is the plus minus. Now, this rule applies to traditional questions that are on the NCLEX exam and ones that are also within a case study. So the best thing that I can say is there's no guessing. So here's an example of a select all that apply. That's a traditional. We hate to use standalone because standalone now stands for a trend or a bow tie on the NCLEX exam, but this would be a traditional question here. This has plus minus scoring. So this example of a select all that apply question is considered traditional. It's worth only 2 points. Okay, that means that there are 2 correct answers, which you can see here would be number 1 and number 4. But this student also selected number 6. Okay, so because of that, they were deducted 1 point from their score. If a student had simply only answered the first one, I'm 100% sure of option 1, they would have at least gained 1 point. But what you see here is that the student, they did get 1 correct, but they also got an incorrect, so they washed each other out for a score of 0. Okay, so as I just mentioned, guessing does not work with select all that apply questions. We really need to stress that with the students. This is one more example of a select all that apply, and it's called a highlight. In this one, the student's asked to highlight the data that indicates that the client is experiencing anxiety. This student selected 6 correct options and no incorrect options. And you'll see I did highlight them just a little bit so you could see the positives of it. Okay, so this student would get full credit for this question here. So we're going to move on to the rationale scoring rule, which is applied to items assessing peered information. And I really can't stress that enough. It's data that needs to be peered together. So these are concepts that require justification through a rationale. The students must select the condition and the relationship. So what do I mean by that? On here, you'll see examples of rational scoring, and it will always say as evidenced by, as a result of, or due to, just to mention a few. NCSBN uses the following terminology in their scoring model document. The nurse must perform X because of Y. They have two different types, a dyad and a triad. So this would be a dyad. So the nurse must perform X because of Y. This slideshow shows three different options here in the middle of the page. As I mentioned, rationale scoring, students must pair their answers correctly to receive any credit. The first example, the clients at highest risk of developing X as evidenced by Y. And you can see that this demonstrates both selections were answered correct, so the student would receive 1 point. Notice I did not say 2 points. Because they are paired together, they are only worth 1 point, okay? And that's important to understand. In each of the other two options, the student has answered one of the selections incorrect, so they receive no credit at all. Remember, both must be answered correctly to earn 1 point. Depending on how a drop-down question is actually written will determine if it's a 0-1 scoring rule or a rationale rule. That's a little bit challenging. So what's the giveaway? When you look at this question here, you'll see the words as evidenced by, okay? That makes it a rationale question automatically. If X, then Y, and maybe even Z, okay? So a dyad, as I mentioned, is X, then Y, but a triad would be X, then Y, and Z. So when you see, there's technically, if you would, two questions here, okay? The first one is paired with the first symptom. Again, if they get the first selection of hyperthyroid, it can also be paired with the second symptom, okay? So they got the first pairing correct, that earns them 1 point, but the second pairing, if you would, was incorrect, so they did not gain a point for that, okay? That's the most difficult, I think, of the three models to explain to students. So I wanted to show you one more aspect here. If you are using Kaplan, this would look familiar to you. This is our student site. As soon as the student finishes their exam, they are given their score here. So this student scored 68% of the questions correct. And the main reason I picked this, I wanted to show you, this is one of our practice tests, our focus review. There were 30 questions on this test, but the points were worth 56. So when you see those points awarded next to the percent correct, you hopefully now understand how they earned more points. So a select all that applied, we saw it was worth 7 points. We're going to automatically make that 37 points and more. When you look at the bottom, we will have the scoring guidelines there for each one. But at the bottom here where I have the yellow arrow, you can see the first two questions were answered correct. So we used the red light option. Those were correct. The first one, they got 2 out of 2 points. The second one, there was only one option, so probably a multiple choice, okay? And that was 1 out of 1. But I purposely picked this one to show you the yellow highlighting. And that shows you, not that they got it incorrect, but they only got partial credit on these. So once I start seeing 3 yellows, 4, 5, 6 yellows in a row, I can automatically, if I hate to say this, assume this was probably a case study question. And we are seeing that students are struggling with those case study questions, okay? But this is a perfect example here. And the feedback that I would give to the student is you're doing okay. Maybe you've got to slow down. Let's talk about your strategies of testing. So on question number 3, they got 3 out of 4, almost there. In the past, that would have been marked incorrect. This one, you can see the points, and again down here, okay? So it's important that students read those questions and follow all of the rules. So what are our benefits to partial credit scoring? I hope from looking at the slides here that you actually see the importance of the partial scoring to help you develop new test questions. We hope that we know we all want precise measurement of all of our tests. We want to make sure we're as accurate as possible. Another advantage that I like a lot with the partial credit scoring is it reduces random guessing. And we know we all have students who are great guessers. They'll say, oh, it's between 1 and 4 or 1 and 2. Let me guess. And it doesn't really measure their knowledge level. So that's why increasing the level and looking at the clinical judgment, we're really able to tell where students are in their learning process. Here's the disadvantage of it, if I would. Each meeting that I have with faculty, they report having difficulty utilizing these new scoring methods because their LMS system or their learning management system does not allow their computer to follow the same rules as NCSBN. Okay. Neither Brightspace or ExamSoft. Many of my schools use those, and faculty would say, how do I grade them then? What can I do? They do say, and a few LMS systems will report that they are scoring with the new rules, but what they are doing is only awarding a point. They are not subtracting a point from the incorrect questions. So be careful when you're talking to the owners of the LMS system and you're inquiring about things. Make sure that you're asking specifically about these 3 methods, and in particular the rationale, where they're going to not get it correct or where they're going to lose a point with the plus minus. So here's what I say to you: be creative. We always have to think outside the box. You can develop a 6-question case study that you can use in a simulation lab, or you can bring into the classroom as active learning. Okay. Yes, this may mean that you have to use paper and pencil, but it allowed the student to see how the new scoring will directly impact how they answer their questions. Kaplan students have a great advantage in seeing the new rules on each and every one of our practice and secure questions. All of our questions in our Q bank and on our NCLEX resources use the partial credit scoring. So practice makes perfect. Okay. The more experience the students have with this, so the more you implement it into your classroom, the more practice tests you use, all of those, the more prepared the student's going to be when they sit down to take their actual NCLEX exam. So you heard me talk an awful lot about this one document. I had to put a picture of the document in here. So in summer of 2021, NCSBN released this document explaining the new rules. I have to tell you, it's the most helpful document I have found to explain all of these scoring models. This document can be found directly on the student site. You saw when we clicked it on, the students can go right to it for that specific question. It helps to confirm how they're being graded, and especially when they question you about the new scoring methods. You can feel confident to say, well, let's click that on and see what Kaplan says this type of question is. Okay. This document can also be found on the NCSBN website, and I put that reference down at the bottom here. I thank you for joining today. I hope you have a better understanding of the scoring models that NCSBN is using, and I encourage you to think outside the box and be creative. Look at how you're writing test question. Try to utilize these new rules as best you can. Remember, paper is still available. Okay. And I know if you have big cohorts, it's very difficult to do that. But somewhere along the way, we have to be teaching these students about the new methods and what they should be doing to actually score their test questions. I have put some references in here that will be attached as you go along. And again, thank you for participating today. Meredith, are there any questions that I can help answer?
Thank you so much, Karen. That was wonderful. And there have not been any in the chat. So I think you covered it really well as they've been going through. A lot said that it was great resources as you were going through, especially the NCSBN release of that document that you just had on the screen. They liked that. I did, for those of you that are here, I have the evaluation link in the chat. If you don't mind clicking that link before you leave and filling out that, we really appreciate and value your feedback. That is also how you will get emailed your participation certificate. So we appreciate you coming today. Are there any questions for Karen right now that anybody would like to ask?
There's a lot to learn. I'll just
It
say
is a whole lot. It
it's
is,
a
and I
lot.
just appreciate it. So it's always good to have a refresher on that. So
And I know some
everybody,
of you have not used them at all, so it's something we really need to push these companies to move forward and, all these LMS systems. I mean, there's Sakai, Blackboard, Canvas, ExamSoft. I mean, I could name them all. And from what I know so far is no one else is using the true NCSBN scoring rules. Okay, we all need to have that and make sure that our students have that experience. So
Karen, they want to know if you can put that link to that document from the NCSBN in the chat.
let me do this. Hold on, I'll go back right into the slide here. Oh, no more.
That one is a great document. So
Yeah, I was just going to share the screen here so you can see it again, nice and big. Let me say this, it's difficult to find on the NCSBN website. I have a paper version that is well loved that I always do, but it's NCSBN Next Generation NCLEX Scoring Models Generation. Certainly, let me see if I don't think I can take it from there. Let me see if I can take it from this slide. Now, because my slides were saved in PDF for our team, I don't have it. But if you need it, please reach out to your nurse consultant, any one of us. And I, like Meredith said, this presentation will be available to you probably in 24, 48 hours. So go back in where you registered or back to the faculty site if you're a Kaplan user, and the recording of this will all be there. So you'll be able to write this down and not have to rush or say, oh, I answered it incorrect for some reason. Disadvantage of saving the presentation this way, sorry.
mhm. Yeah, and it's a great resource, and they do submit newsletters quarterly or seasonally. Is usually how they like to title them. So they're great resources for the NCSBN if you are not already signed up for those. Any other questions?
You said the link doesn't work. If you need to, please feel free to, and let me put my email. I'm going to put my email in the chat. Send it to me. I will send you the document. I have it saved. As I said, for me to find the link to cite this in the presentation, it took me a little while to get there.
And
So
yeah, I think actually one of the other nurse consultants had it, so they put it in there for you, a link for you there. So
okay, great.
it's perfect, and that one worked. Good, great, glad we could get that. Thank you so much. Any other questions?
Okay, sounds good. Thank
Well,
you.
if there are no other questions, y'all have a wonderful day. Again, I will post the evaluation link again at the bottom of this chat so far, so you can get that before you leave. And we really appreciate you all coming today, and we look forward to hearing from you all soon. So thank you.